Today I'm going to go over the Ortho, Neuro, and ENT practice exam that I gave you guys last week. So we're going to jump right in. When I give you guys the answer, I'm also going to give you the page number in the fuller textbook so you guys can go back and look at that information if you don't understand why it's that answer. First of all, number one, which of the following instruments would be used to remove nasal polyps? And the answer is going to be the wild forceps. Under direct visualization of the nasal endoscope, the surgeon uses either a wild forceps or microdebrider to remove the nasal polyps. That's going to be on page 685 in your fuller textbook. Number two, at which age is cochlear implant contraindicated in children? The answer to number two is A, under 2 years old. So you don't want to do the cochlear implants in children that are under 2 years old. Congenital deafness in the child can be treated with cochlear implant, but surgery is delayed until 2. So they wait until the patient is at least 2 years old. That's going to be on page 679. Number 3, earwax is known as cerumen. A, page 662. That one's a pretty common question to see. You may want to just keep that in your knowledge bank and remember that because I've seen it a lot. Number 4, the blank transmits the vibrations of the tympanic membrane and the other ossicles in the inner ear via the oval window. Answer to number 4 is A, the stapes. The stapes stirrup transmits the vibrations of the TM, or the tympanic membrane, and the other ossicles to the inner ear via the oval window. There's more information on page 663 on that question. Question 5, reconstruction of blank and the oropharynx and the uvopalatal is performed to reduce and tighten oropharyngeal tissue. So the answer to number 5 is C, it's the uvula. Reconstruction of the uvula and oropharynx and the uvopalatal is performed to reduce and tighten oropharyngeal tissue. Page 688 in fuller textbook. Number 6, a blank suction device is used to remove the morcellated tissue. Number 6 would be a number 12 Fraser suction device. That is going to be used to get morcellated tissue. That's going to be on page 685 in your textbook. Number 7, the primary reasons for performing an adenoidectomy are blank infection and obstruction caused by the hypertrophy of the tissue. Number 7 would be chronic infection. The primary reasons for adenoidectomy are chronic infection and obstruction caused by hypertrophy of the tissue. You can find out more information about that question on page 688 in your fuller textbook. Number 8, the neck is anatomically divided into triangles for blank. Well, the neck is divided into triangles for identification. There's more information on that question on page 693 if you don't understand it. Question 9. During a tracheostomy, the blank is kept with the patient in his or her room. This is a very important question. The operator always goes with the patient to the room in case they need to readjust that trach for any reason or it needs to be reinserted. There's more information on that question on page 692. 10. Myringoplasty is performed The myringoplasty is performed to close a small non-healing hole in the blank. So number 10 it's the tympanic membrane, TM. So you may see tympanic membrane, or it may just say TM as for the answer. So just keep that abbreviation in mind. The TM is the tympanic membrane. The question can be found on page 675 in your textbook. "11. The blank is situated behind the nasal cavity and above the oral cavity. So 11, the answer is C. Nasopharynx is situated behind the nasal cavity and above the oral cavity. This is an anatomy question. You may want to look this up if you don't really understand the ENT structures and all the ENT anatomy. There's some more information on this question on page 680 in your textbook. 12, Turbinectomy generally is performed at the same time as blank. 12, the answer is A, same time as a septoplasty. You can find more information about this on page 686 in your textbook. Number 13, the parathyroid glands are situated within the lobes of the thyroid. So the answer was, the answer to 13 was parathyroid glands are situated within the lobes of the thyroid. That's going to be page 694. (14) The paired blank sinuses are the large sinuses below the ocular orbits. And so 14, it's going to be the paired maxillary sinuses are the large sinuses below the ocular orbits. And that's going to be on page 680 in your textbook. 15, an incision made in the blank below the obstruction with the 15 blade. So 15 is an incision made in the nasal septum below the obstruction with the 15 blade. If you don't understand that question, there's more information on page 687. 16. Most endoscopic procedures of the nose are performed to treat blank. Most endoscopic procedures of the nose are done to treat inflammatory or infectious diseases, so that answer would have been D. More information on that question on page 685. A cochlear implant is used to transmit external sound directly to the blank. 17 would be it's going to the 8th cranial nerve, and it's used to treat the sensorial neural deafness, and that affects the 8th cranial nerve. More information on that question on page 678. And just keep in mind, those cranial nerves come into play a lot of questions, so you may want to know the function and what each one of those nerves is responsible for. 18, a cholecystoma, eustachian tube dysfunction, neoplasm, congenital malformation of the middle ear may block airflow to the mastoid and cause chronic blank. It can cause chronic mastoiditis. That's going to be on page 676 in your textbook. Here's that question we were talking about. The abbreviation TM stands for tympanic membrane. That's going to be on page 663 in your textbook. 20, the 30-degree scope is used for maxillary and sphenoid and blank sinus procedures. 20 is the ethmoid sinus procedures is also included with the 30-degree scope. That's going to be on page 685 in your textbook. The submandibular duct or Wharton duct emerges from the deep anterior portion of the gland and drains into the blank floor of the mouth. The 21, it emerges from the deep anterior portion of the gland and drains into the anterior floor of the mouth. Question 21, you can reference that on page 694 in your Fuller textbook. Thyroid hormones are necessary for regulating blank. They are necessary for regulating cell metabolism and growth. You can get more information on that on page 694 as well in your textbook. A blank is almost always combined with a laryngeotomy. Excuse me, let's go back and read that one again. A blank is almost always combined with a laryngectomy to treat laryngeal metastasis and problems with aspiration. 23 would be a glossectomy, would also be used in combination with that procedure. Page 701 will give you more information on question 23. The middle shaft of the long bone is called the blank. The diaphysis is the middle shaft of the long bone. Page 763. There's a lot of information on the anatomy of the bones and structure of bones there for you. The patella is an example of a blank bone. Patella is a sesamoid bone. You can get information on page 753 on that question. 26, the blank part of a long bone is very dense and is found on the outside. See, the cortical part of the bone is very dense. You can get more information on that as well on page 753. A rounded orifice in a bone or passageway for blood vessels or nerves is known as, that's a foramen. Question that was answer A. More information on that structure on page 755 in your Fuller textbook. Blank protects the bone surface and provides attachment for tendons. 28, so the periosteum protects the bone surface and provides an attachment for tendons. That's going to be on page 753 in your textbook. We're on question 29 now. A knuckle-shaped portion of the bone generally found in association with a joint is called the condyle. More information on that question, page 755 in your textbook. Gonna move along here. We're on question 30. During blank, the glenoid rim is reattached to the joint capsule with a biosynthetic or other anchoring device or heavy sutures. So during the Bankart procedure, which is C, the glenoid rim is reattached to the joint capsule with a biosynthetic or other anchoring device with heavy sutures. More information on question 30 on page 776 in your textbook. 31. The goal of the Bankart procedure is to correct a recurrent anterior dislocation of the shoulder. And that was going to be D on that one. And more information on question 31 on page 776 as well. Question 32. The orthopedic table, also called the fracture table, is used mainly for surgery of the blank. It's normally used for surgery of the femur and lower leg. It actually approximates the leg when there's a fracture. They can reduce that fracture and then are able to either put a nail or plate or screw, whatever they're going to do to fix that fracture with that table. There's more information on the orthopedic table on page 757 in your textbook. 33, blank is used in first level assessment for most orthopedic case. Blank is used in the first level assessment for most orthopedic trauma. 33 is D. They use x-rays in orthopedic trauma so they can see the bone and the fractures. More information on page 756 for that question. 34, fractures. Blank fractures are fractures in which the bone penetrates the skin. Remember this, guys, because I've seen this on a couple of tests. And it's open fractures, obviously, are the ones where the bone is sticking out of the skin. More information on different types of fractures on page 759 in your textbook. A fracture caused by disease is called blank. So number 35, it's a pathological fracture if it's caused by a disease. Like I said, there's more information on the different types of fractures on page 759 in the Fuller textbook. The blank is the most complicated joint of the body, vulnerable to a variety of injuries. 36, so it's the knees, the most complicated joint of the body. And you can get more information on the knee joint on page 796. 37, a sagittal blade is fixed at a right angle to a handpiece and moves along a perpendicular axis. So just keep in mind that the sagittal blade is fixed at a right angle, 90 degrees, to the handpiece and moves along a perpendicular axis. And you can get more information on sagittal blades on page 762 in your textbook. 38, K-wires, Steinman pins are inserted directly into the tissue using a blank. 38, you're gonna use a power drill to insert those K-wires and Steinman pins. The more information on those on page 771 in your textbook. An open reduction internal fixation requires the use of orthopedic implants. That was going to be 39. It was blank requires the use of orthopedic implants, and it's either going to be, you may see it on the test as ORIF or open reduction internal fixation. More information on that procedure on page 760 in your textbook. An orthopedic drill is similar to a blank drill. This question was a little bit harder because there's several drills that it could be similar to. What they're looking for is an orthopedic drill is similar to a carpenter's drill. More information on that question on page 761. Question 41. Elevators are used to lift blank. An elevator's main function is to remove or scrape away the periosteum, the tough outer membrane of the bone, and that's also what holds the tendon attachment to the bones, remember, for the bone surface. That answer was B. So elevators are used to lift the periosteum from the surface of the bone. And so that's going to be found on page 766 in your textbook if that's a question you need a little more study time with. Whenever power-driven cutting instruments are used, the scrub should blank. When you're using a power-driven cutting instrument, the one thing you want to do in surgery with those is you want to lightly irrigate the blade. You don't want to flood the blade. You want to take a little asepto syringe and just kind of squirt the blade. That, for one, keeps the bone from going all in the air. It also keeps the blade from overheating too bad and burning any other delicate tissues in the body. More information on page 761 on irrigation of power tools and saws. 43, during arthroscopy, blank tubing and blank tubing are required to maintain continuous flowing of the joint, or a continuous flushing of the joint. So during a arthroscopy, you always want to have an inflow and outflow tubing. So one's going to be bringing saline into the joint, the other one's going to be bringing the fluid out, and that includes blood. So it's constantly irrigating that joint. All the blood, all that debris that's in there that if they shave off or clean out can be flushed out. That way they have better visualization of that joint. 44, blank and blank cutters are used for trimming and modeling bone and cartilage. So 44 was A, rongeurs and bone cutters. You can get more information on that on page 765. 45, cancellous bone blank. 45 is B. So cancellous bone resembles a sponge and the spaces are filled with red and yellow marrow, a soft connective tissue. More information on cancellous bone on page 753 in your textbook. 46, the neuron is the blank type of nervous system located throughout the body. So the neuron is D, the cell type of nervous system that is located throughout the body. More information on neurons on page 938 in your textbook. Question 47. The blank acts as the sending and receiving area for the nerve impulses and is the energy center of the cell. It's the soma acts as the sending and receiving area of the nerve impulses and is the energy center of the cell. Page 938 in your textbook. 48, the blank carries nerve impulses toward the cell. 48 is C, it's the dendrites. More information on that anatomy is going to be on page 938 in your textbook. Question 49, the blank carrier carries nerve impulses away from the cell. The axon is what carries the nerve impulses away from the cell. More information, page 938. Question 50. Two temporal bones are on either side of the skull, which contribute to the structure of the sides of the cranium. So there are two. The answer was temporal bones are on either side of the skull, which contribute to the structure of the sides of the cranium. Now we're into the neuro part of the book, so you can get more information on this question on page 938. 51. One of the blank bones provides structure to the forehead and orbits. 51, the answer is gonna be A. One frontal bone provides structure to the forehead and orbits. More information on the anatomy of those bones in the forehead and orbits is page 938 for us in your Fuller textbook. 52, one blank bone provides structure to the back of the skull and portion of the floor of the cranium. So 52 was C. It's the occipital bone. It provides structure to the back of the skull and a portion of the floor of the cranium. More information on it as well, page 938. 53. Two blank bones on either side of the skull provide structure for the sides and roof of the cranium. 53 was B, so two temporal bones on either side Provide structure to the roof and sides of the cranium. More information, like I said, we're still going to be on page 938 in the textbook for all these different bones here for this skull. 53, we did 54. The pericranium is the periosteal layer of skull bones. It is covered with all of the following except. So it's covered with all of the following except the cerebellum. The cerebellum is not a, let's go back to that question. The pericranium is periosteal layer of the skull bones. It is covered with all of the following except. So it's covered with everything except dura. Dura is the top lining of your actual brain. So keep that in mind. That's actually a layer of the brain. Everything else, it's covered with muscle, gallia, and skin, all come into effect. More information can be found on this question on page 938 if you need a little more assistance with the layers of what covers the skull bones. The brain is divided into three main sections, including all the following except. So it's covered with all the following except the pericranium. More information on this can be found on page 938. But the main three sections are the cerebrum, the cerebellum, and the brainstem. So you might want to, take notes on that and remember that for your future studies. '56. The blank is also known as the forebrain. So the cerebrum is also known as the forebrain. Also, more information on that question, page 938 in your textbook. 57. The blank is also known as the hindbrain. So the hindbrain is also known as the cerebellum. It's in the back of your brain. Page 940 for more information on that structure for you. The major structures of the midbrain include all of the following except. So they include all of the following except A, the thyroid gland. Thyroid gland is obviously in your thyroid, in your neck. Keep that in mind for that structure. More information on page 941 for the main structures of the midbrain are the thalamus, hypothalamus, posterior pituitary gland, and pineal gland. How many cervical vertebrae are there? Question 59. There are 7 cervical vertebrae. You can reference this question on page 942 in your textbook. Question 60. How many lumbar vertebrae are there? There are 5 lumbar vertebrae. Page 942 in your textbook for more information on the different vertebrae. We're going to go into how many sacral vertebrae are there? Question 61. There are 5 sacral vertebrae, also on page 942. The next question, 62, the thoracic vertebrae, and there are 12 thoracic vertebrae. You can reference that on page 942 as well. Question 63. The blank nerves that originate in the brain are responsible for sensory and motor functions of the body. So that is going to be B. The cranial nerves that originate in the brain are responsible for the sensory and motor functions of the body. Page 943 for more information on those cranial nerves for you. 64. Blank nerves are composed of small bundles of nerve fibers called fascicles, which are surrounded by a sheath called the endoneurium. So 64 is going to be the peripheral nerves. Peripheral nerves are composed of small bundles of nerve fibers called fascicles, which are surrounded by a sheath called the endoneurium. Page 944 if you need a little more reference help with that question. 65. The blank nerves occur in pairs and originate from the spinal cord near the corresponding vertebrae. Answer to 65 is the spinal nerves occur in pairs that originate from the spinal cord near their corresponding vertebrae. Page 943 in your textbook. 66. Small square felt sponges made of cotton or rayon to control bleeding on neural and vascular tissue are referred to as D, cottonoids. And those are those long strips that we see that have the string coming off that they use in surgery. It's a counted item, so it is something that you have to count in surgery as well. Page 950 is a good reference for you on the cottonoids. What type of dressing would be placed on a spinal incision? 67 is going to be D. You're going to use Telfa. It's a non-adherent cover for the spinal incision. You can get more information on those dressings on page 950 in your textbook. 68, Gardner-Well tongs may be used to secure blank. The Gardner-Well tongs are used to secure the patient's head. So you can get more information on those tongs on page 952. 69, all of the following are patient position devices except. The only one on that list on 69 that is not a patient position device is the Telfa. The Telfa is obviously a wound covering. Headrest, operating OR table, Wilson frame are all patient positioning devices. You can get more information on different devices used for positioning the patient on page 950 and page 952 in your Fuller textbook. Question 70. During a craniotomy, the patient is positioned using a blank headrest or pin fixation. So during a craniotomy, they use the horseshoe headrest sometimes for positioning of the patient's head. That is going to be found on page 952 in your Fuller textbook as well. 71. What type of ESU is used during a craniotomy? And that is a bipolar. They use the little bipolar forceps to control hemostasis during craniotomies. Page 953 in your textbook. 72. During a microdiscectomy, what type of retractor is used? So during a microdiscectomy, you got to keep in mind this is a minimally invasive procedure. They're going to use the tubes. So it's the tubular retractors that they'll insert a tiny little tube down into the spine so they can take out that disc. Page 977 for more information on this question. 73, the wound edges, during a microdiscectomy, the wound edges are approximated with blank, and they'll use steri strips or dermabond glue, so it could be A or B for this question. So more information on the dressings and approximating the edges of microdiscectomy on page 977 in your textbook. Final question. During microdiscectomy, gel foam pledges are soaked in blank. They're always soaked in thrombin. You can get more information on that question on page 977 in your textbook. So guys, that completes this week's practice exam review. As always, if you guys need anything, please email me. Reach out to me for any other questions you have. Let me know how studying's going. Otherwise, have a great week, and we'll talk soon.